Good evening and welcome to our Good Friday night news update. Most of the results from the random testing of 400 people in the community are now in, and these have illustrated that around 2.5% of the population is suspected to have COVID-19. This is according to the Minister for Public Health, Dr. Cortes, who is speaking at the daily press conference from number 6.
There have been 10 positives out of a sample of 400, which corresponds to approximately 2.5% of the population, which would indicate that at the time there were around 800 people who would be positive for COVID-19 in Gibraltar. Of these, 117 have been detected from the 111 calls and from people who have presented at the DHA, which is 14.5% of the number we suspect that there are in the community. This could indicate, as expected, that there's a considerable number of symptom-free carriers. Indeed, 6 of the 10 positives in the random samples did not have symptoms and would probably not have been picked up had they not been chosen for the sample. We must obviously expect that at least a proportion of these will develop symptoms in the next 7 to 10 days and will either call 111 or present at the hospital if symptoms are more acute, although as a first step, we do advise people to call 111 when they have any concern. Public health advice remains that we will see a surge in hospitalization, possibly next week, as those affected in the community develop symptoms. The potential remains that the hospital could fill up in just a few days when this happens, as has been seen in other countries. We are, fortunately, ready for this. On a more positive note, the statistical teams from the GHA, Museum, Botanic Gardens and the university have analysed the data by age, separating the over 70s from the under 70s. Results show that those tested at the time of the analysis, of those tested, 17% of the under 70s were positive, but only 5.5% of the over 70s were positive.
Dr. Cortes confirmed that another round of random testing will be carried out in the future. However, he said, although the new in-house testing will allow for the analysis of around 260 swabs a day, there is a global shortage of the reagents needed, so the scope of the current testing regime will not be widened. Dr. Cortes also highlighted that the number of recovered COVID-19 cases currently exceeds those active, although he said the government is still anticipating and preparing for a potential surge in hospitalizations next week.
A&D statistics. In total, there were 32 attendances in the 24 hours to 8:30 this morning. Of these, there were 6 with COVID symptoms, 5 in the day and 1 overnight. 2 were swabbed, all were sent home. There were no admissions for COVID-related symptoms. The bed situation, apart from the 190 beds at the Nightingale facility at Europa Point, as of this morning, there were 4 COVID patients in St. Bernard's, 3 in John Ward and 1 in ITU, none in ventilation. And now for the latest test results. I can confirm that tests are now being done locally. All the reagents are now in the GHA lab and the lab staff are fully trained up and carrying out the tests successfully here in Gibraltar, although we continue to have access to the testing laboratories in Spain and the UK. So the numbers now, the total swabs excluding the 400 random samples, those are a total of 1,143. There are 47 results pending, 1,096 results received. Confirmed cases so far, 117, active cases 49, recovered cases 68. From the random sampling, there were 400 swabs taken. There were 10 confirmed cases, 9 of which are active, 1 of which is recovered. The grand total is now, taking all those figures together, the total number of swabs 1,543, pending results 51, results received 1,492, confirmed cases 127, active 58, recovered 69.
The Minister for Public Health said the number of new positives a day is decreasing. He said there are 127 positives at this stage, adding that one of the prediction models used by the government had shown that there could have been closer to 1,000 if lockdown measures had not been implemented.
Clearly, the predictions were predicted at the time we predicted them. The predictions were based on experience elsewhere in the world. We looked at worst case. It's always important in this sort of situation to plan for worst case. Better to be relieved that you didn't have to than to find that you had estimated the problem. So these data were all based on worst case before we even considered a lockdown. Then we took the different steps, and clearly we have seen that the surges have been controlled, so to speak, because of the different steps we have taken. We are now tracking the data. We're now seeing how it varies from the different scenarios, and obviously also cross-referencing with other countries, particularly small countries. But as I say, the prediction was a worst-case scenario without any action. The action we have taken has improved the situation, but it's equally important that we continue with this action so that we don't have to go back and reassess it with a curve suddenly becoming steeper again.
Dr. Cortes confirmed that a dress rehearsal for the field hospital is set to take place on Wednesday. With the news that 8 Canadian nationals were allowed to disembark from the cruise ship Viking Sun today, which is here on a technical call, Dr. Cortes said that all decisions as to whether or not to allow people to disembark in Gibraltar are taken by the Director of Public Health and will not be allowed where there are confirmed COVID-19 cases on board. And the Minister for Civil Contingencies, Samantha Sacramento, said the government is working to ensure that anyone who is vulnerable is not made more so by the lockdown restrictions.
What we've done is look at already existing multi-agency strategies, and these have been enhanced specifically to cater for this COVID period. In particular, and in addition to looking at vulnerable elderly people, anyone with underlying health conditions, anyone over the age of 70, we are also looking at children and ensuring that they are not exposed or more vulnerable because of the times that we find ourselves in. I have been briefed by the Children's Services of the Care Agency and the Department of Education and Psychological Support Services on their excellent co-working strategy to identify and assess and provide for vulnerable children, and they have an excellent outreach mechanism in place. In relation to domestic abuse, the government has escalated its existing domestic abuse strategy and convened a strategic multi-agency working group specifically for the COVID-19 period. During these times of isolation, anybody feels that they need particular assistance, it is important, if the matter is urgent and you fear for your life, call the police immediately on 199. If you want general advice on how we can help, please call our helpline on 41818. There is a specific group to give advice on anything, any aspect in relation to domestic abuse, including referring you to counselling services. What I can assure is, if somebody contacts the police on the emergency number, the police will attend immediately. So that person will then be assisted and supported immediately and will be out of immediate danger. If that person cannot physically call, then perhaps they could reach out to a friend or somebody else for them to pass the message on to the police. The police are acutely aware that this is a possibility that could happen, and they are ready to help, to assist in all these eventualities. In relation to the second part of the question, we've already made provision for secure accommodation to be made available to people who are at risk of domestic abuse. So for the period while the matter is being considered, they will be safe. Now, going forward, there are different options and different avenues that can be explored, but certainly we would not want anyone to be put at risk, and there are resources available to help everybody, particularly to help anybody get out of a situation in where their lives or the lives of their children could be in danger.
Ms. Sacramento also highlighted that the Bruce's Farm drug service continues remotely and can be accessed by calling 200 48444. She also praised the COVID welfare team led by Giselle Carreras, which is offering psychological support to the community and in particular resilience training to frontline staff. And Ms. Sacramento also praised the community for donating its time, food, money and skills to the COVID-19 effort.
And on that point, can I please ask everyone watching to consider that not everyone has an iPad or a tablet, and I have been asked to invite any organisation or anyone who may have recently updated a device to consider donating your old one if it is unused, and we can pass this on to children who may need them, or to help an elderly person to keep in touch with family during these isolating times.
And on that note, there have been a number of further donations to the GHA's COVID-19 fund. The Port Authority launch crew has raised £1,005, with the residents of Bishop Ganiya House donating £550 and the Petanque Association also donating £500. Thank you for watching this news update on GBC Television. Remember, we'll be back at the same time of 8:30 tomorrow evening. Good night.